Hi everyone, I am Dr. Anthony Dakpallah, but you can call me Tony. Welcome back to our series of pregnancy scans. In the last episode, we talked about your first trimester scan, that exciting first look at your baby. Today, we are moving on to the second trimester scan, also known as the Anomaly scan or mid-pregnancy scan, and it's usually done between 18 weeks and 22 weeks. And trust me, this one is a big deal. What this scan is really about. Now, by this time, your baby has grown a lot, and so has the information we can get from the scan. The second trimester scan is not just about seeing your baby move or finding out the gender. It's a detailed medical check from head to toe. We look at the baby's head, the brain and face. We look at the spine, the heart, and major blood vessels. We look at the stomach, the kidneys, and the bladder. We also look at the arms and the legs, the umbilical cord, and the placenta. Basically, it's a way of making sure that the baby's organs are developing properly and that everything looks normal for the stage of pregnancy. So, what happens during the scan? The scan is done over the tummy using a bit of warm gel. Nowadays, the machines or molding machines have a warmer that warms the gel, and so most of the time the gel wouldn't be cold. It usually takes 20 to 30 minutes depending on how the baby is positioned. You probably see your baby moving, kicking, or even sucking their thumb. And yes, it's amazing as it sounds. Sometimes, if the baby is not in a good position, we might ask you to move about a bit and or even come back later to complete the scan. And this just is normal. We want to see everything clearly and not just guess. Babies don't always cooperate when we need them to, and so there are instances we may just have to take that decision of making you go and come back again for the scan. We take very specific measurements during this scan, things like the head circumference, the abdominal circumference, and the femur length. That is the thigh of the thigh bone of your baby. So we measure the length. And these help us to estimate the baby's growth and the baby's weight. We also look at the amniotic fluid index or level and the placenta's position and how the umbilical cord is attached. All these are important for planning a safe delivery later on. So, why does this scan matter so much? The scan can pick up certain abnormalities or birth defects early. Things like heart defects, kidney issues, or problems with the spine. If something unusual is seen, it doesn't always mean bad news, but it does help the doctor plan what to do next. Sometimes you might be referred for a follow-up scan or to a specialist center for more detailed imaging. The goal is simple: to give both mother and the baby the best possible care well before delivery. Can I find out my baby's gender? Yes, if your baby's position allows and your clinic policy permits it. But remember, that's just a bonus. The main purpose of this scan is to assess your baby's health and anatomy. Is this scan safe? Absolutely. Ultrasound uses sound waves and not radiation, so it's completely safe for you and your baby. So why do reports sometimes take time? It's because the radiologist carefully reviews every part of the scan, sometimes frame by frame, before finalizing the report. It is worth the wait because accuracy matters. Now, what comes next after your second trimester scan? Your doctor or midwife will review your report with you, and they would plan the rest of your antenatal visits. Your next scan will usually be in the third trimester to check how your baby is growing and to see the position before delivery. That's what we'll talk about in part 3, coming soon. So, that's what happens during your second trimester scan. It's not just a routine step, it's a powerful way to check that everything is going beautifully inside the womb. If you found this helpful, please like, subscribe, and share with any expecting parents you know. And remember, every scan tells part of your baby's unique story. See you in the next episode where we'll explore what happens in the third trimester scan and how we track your baby's final weeks before birth. Have a good day.